Yeah, from here, I guess.
Hello?
Yes, sir, you can start with this
Hello?
quantification of absolute activity for therapy applications
Yeah.
in spec.
Yeah. Therapy application. So, this actually also playing a very important role to see the response of the therapy. That is pre-treatment pressure imaging to predict the absorbed dose during the therapy, and post-therapy imaging to monitoring the radiation dose during the therapy to establish the correlation between the dose response and toxicity. The SUE estimation of individual lesion helps to determine the total tumor pressure concentration and clearance, enabling assessment of total tumor dose. This is the example where we have given a lutetium 177 dotatate to treat the tumor in the liver and measure the SUV values at different time intervals. That is 2 hours, 24, 48, and 72 hours. And we saw that there is no change in the SUV at 48 and 72 hours. It shows that the medicine remains in the tumor and delivering the dose to the tumor. In the second example, so I will explain one by one. This is the that how the SU value is affected by the FOV. The effect of FOV change on standardized uptake values. SUV measurement of lesion in 60-year-old man with metastatic melanoma. Initially image reconstructed with 50 centimeter FOV and 70 centimeter FOV, that is in the B, to include area of primary disease in left forearm. Different FOV with same image matrix size will change the placement of image matrix voxel relative to lesion in images. This can substantially affect SUV measurement of lesion. 70 centimeter FOV SUV value 4.7, where is 50 showing a 3.9. Sometimes the speed also affect your SUV values. You can see here when the speed is 360 seconds per bed position, the SUV value is 6. When the speed becomes 150 seconds per bed position, then SUV value is 5. So reliability of measurement depends on two factors, that is accuracy and precision. Often good precision is as or more important than the good absolute accuracy. These are the different challenges which can affect your quantification in the nuclear medicine. This is the natural background. Now, patient in neighboring rooms or consider and residual activity can result in background radiation. Low count study degrade the quantitative information, needs radioactivity compensation before or after imaging the patient or both. If background is high, need cleaning, additional shading, background image or count subtract from the patient information. If your background is equal to the gross counts, then it becomes not significant. When gross count is more than background, then it becomes significant. Radioactivity, by definition, radionuclides undergo the radioactive decay, in resulting in reduced activity as a function of time. For quantitative tasks, it is important to account for this effect. For example, to calculate the percentage of injected activity in an organ, one needs to decay correct and measure activity in organ relative to the time of injection and the injected activity from the time the syringe was measured in the dose calibrate. Similarly, for dynamic study, it is often desirable to remove the effect of physical decay by decay compensating back to the injection time. Decay compensation can be accomplished by scaling the image of data by a factor given by decay factor, and that is your dF, where lambda is the decay constant for the radionuclide and T is the time difference between the time for which the counts are decay corrected to and time of the measurement. Noise results from the radiation nature of radioactive decay process. Each atom of radionuclide has the same probability of decay which is independent of time and probability of decay for each atom is independent of other atom. And lower fraction noise can be obtained by increasing the number of counts or by increasing the longer counting time. Radionuclide decay errors significantly influence the image visual quality. Relative random error decrease as count per pixel. You can see the N total increase and per pixel counts will also increase, and it will reduce the random error in the image. His ability to visualize structure and tumor allows the visual effect of random error as a result of the measured quantity. You can see here, when we increase the number of counts, the image quality becomes better than the less counts. Noise is the second example. When we increase the acquisition time, image quality becomes better than the less acquisition time. This is the second example we have. We can show that by using the smoothing filter, you can reduce the noise in the image, but at the cost of the SUV value. The SUV values becomes less when you smooth the image more. So you smooth a image in such a way that resolution and smoothness can be compromised. Peak shifting also affect your image. You can see here, while when we shifted the peak, uh, this is the image when when there is a shifting peak, and this is the image where there when the image acquired in the window at 150 kV. And you can see here, when we acquire the image at 120 kV, then your ejection fraction is 64. When compared to 140 kV image, there is the ejection fraction is 73%, 9% is different. Attenuation and scatter also affect your image quality. Primary attenuation is a loss of count, which is due to the deflection by Compton scatter from detectable path. Scatter is addition of unwanted count due to the deflection into the detectable path by Compton scatter. This is the example. This is the attenuation factor in the spec. It is 5 times to 20 times. In fact, it is 15 times to 60 times. And the scatter fraction in spec is 35%. In fact, 2D 15%, and in fact 3D is 40%. So you can see here, this is the image which is reconstructed by you without attenuation correction, showing a hot lungs and clear in the image, which is disappeared after applying the attenuation correction, and the nose in the axilla is visualizing better, and it is showing there is something which is there is nothing in the media sternum. This is the second example where you can see that non attenuation corrected reconstructed image showing a perfusion defect in the inferior wall of a cardiac, which is disappeared after applying the attenuation correction in the reconstructed image. Scatter, you can see here, because of the limited energy resolution, the scintillation scintillator used in the imaging device, a relatively large energy window is needed to maintain the good quantum statistics. Some photons that are scattered in some small angle in the patient will therefore have a chance to be detected within the energy window. This detection will lead to potential difficulty in quantifying activity and poor contrast. Since these photons carry incorrect information about the point of emission of the photons, the scatter contribution depends on the several factors such as photon energy, source distribution, and tissue composition. In addition to the camera specific parameters such as energy resolution and window setting. You can see here, without scatter, when the energy resolution also affect your image quality. You can see here, when the energy resolution was 20%, image 20% when the image showing a noise in the image, compared to the 15%, 7.5% energy resolution. This is the second example where you can see the after applying the spectral correction, the image resolution becomes good compared to without attenuation correction. This is the third example where you can see after applying the attenuation correction, the contrast resolution increase in case of PAT image. Random correction also affects your image quality. You can see this is the image without random correction showing a noise in the image which is disappeared after applying random correction. Random correction can be applied by using the delayed coincidence window. The motion also affects your image quality, which can be seen here. There are two types of motion: voluntary motion and involuntary motion. This is the example. Voluntary motion can be minimized by using the short acquisition time, instructing the patient to remain as still as possible, positioning the patient to maximize comfort, and using strap, pillow, or other constant to restrict the motion. This is the example where you can see after applying the motion correction, the image quality becomes good compared to without motion correction. This is the involuntary motion. The involuntary motion is due to the respiration, respiration and the cardiac motion. And these involuntary motion can be rectified by using the respiratory gating and the cardiac gating. This is the example where you can see that after applying cardiac gating or respiratory gating, the SU values is increased. Is a regulation and partial volume also affect your image quality. Spatial resolution, which is referred to a camera ability to spatially resolve two sources of radioactivity as a separate point item. Limited spatial resolution results in the PV effect. PV referred to the fact that a pixel includes a mixture of signals coming from different sources and it's affected by two parameter imaging system and the imaging sampling. Owing to the image blur produced by limited spatial resolution, the signal coming from a point source will be detected not only in one pixel but also in neighboring pixels. When considering a functional structure of interest, part of the activity from the structure will also be detected outside outside of the VOI drawn around the structure, and that is called spill out. Conversely, activity from the structure close to the structure of interest will spill in to the structure of interest, and that is called spill in. You can see here, because of the spill out result in estimated reduced activity in a region that has a higher activity than its surrounding. Spill in result in overestimating activity in a region that has lower activity than the surrounding. You can see here due to the sampling also affect your SUV. You can see when the sampling is 4 mm, the SUV is 2.7. When it becomes 6 mm, then SUV becomes 2.5 reduced. This is the example where this is the image which is reconstructed without PVC. And you can see here the SUV in the pre-therapy and the post-therapy remains same. It shows that the disease is stable. This is the image where we applied the PVC for the reconstruction, and you can see here the SUV values is increased after the therapy. It shows that this disease is progressive, it's not stable. So this you can how they it playing a very important. Reconstruction algorithms also affect your quantification. You can see here the when we, and it change your SUV value. This is a second example where you can see when we reconstruct the image by using OSCM, PSF, and time of flight, then your SUV is increased. Then it becomes 3.97 to 4.44. Now, time of flight also affect your image quantification. You can see here, this is the annihilation taking place here, and the distance between these two detectors is D. So this detector detect this annihilation at time t1, and this is at time t2. So both gamma camera and both gammas travels with the speed of light. So difference in time detection by these two detectors is 2t t2 minus t1. And emission origin at distance is d. So where is t2 minus t1 multiplied by c by 2. So but uncertainty is determining time is delta t. So therefore also the uncertainty in determining d is delta d. So you can see here, if you know the T, delta T, you can calculate the uncertainty, and that is 9 centimeter. So if your resolution, this after by decreasing the timing resolution, you can reduce the uncertainty, that is your delta T. So this is the example where we have not applied the time of flight, showing a SU value is higher than the image is reconstructed by using the time of flight. This is the example where the patient is lean. Then you see there is no much difference between the non-TOF and TOF reconstructed image. But when patient is heavy or heavy patient, then non-TOF reconstructed image showing a less contrast compared to the TOF reconstructed image. So in summary, the quantitative analysis has been present. Nuclear medicine from its inspection, quantitative methods that use disease as a linear process and correlate well with degree of disease. Quantification is very important, in fact, to assess the efficiency of new drugs and treatment. Approximate reconstruction and often provide good approximate quantitative accuracy in SPAC. Deterioration in quantitative accuracy with decreased object size when objects below 3 times of the spatial resolution of the system are imaged. If huge standard reconstruction package from manufacturer need to be sure reconstruction is quantitatively accurate. Thank you. Hello.
Thank you so much, sir, for such a
Hello.
nice, elaborative, and interesting talk.
And I'm very sorry because of this. I'm sitting in the desert and there is a
No,
problem in the
no
network.
problem, sir. No problem, sir.
And I
Somehow
would like
it's
to thanks to Dr. Rajni and Dr. Arun for giving me opportunity to speak on the AFOM platform, and to and audience also keep the patience. Thank you very much.